I'd like to start this forum out, this town hall, with an effort to not only update folks on where we are, at least nationally, and also here worldly as well as internationally, here in the US, and then really hone into what's going on in Indian country. My focus and effort is mainly in the Midwest area, and I'll be speaking primarily about Minnesota, Michigan, and Wisconsin. And so that's going to be my emphasis, mainly because we reside here in Milwaukee, and I want to make sure I get information as best as possible to our community as a whole. So this is our first effort, so give me a moment to try to work through this, and we'll go through it and get all the information to Milwaukee as best as possible. So, all right. So, obviously this COVID-19, the coronavirus has taken the world over by storm. It's affected so many different countries and so many different communities. But to look at this from a broad perspective, right now, as of this morning, there's been nearly 3.7 million cases worldwide, and over 257,000 deaths that have occurred. Certainly here in the United States, 1.2 million cases have been identified, and we've been testing on a very large scale, larger than any other country in the world, at 7.5 million. Obviously, we're not immune to the fatality of the coronavirus, 73,000 cases. And here in Wisconsin, we're just a little over 8,900. Nearly half of the cases of coronavirus identified here in Wisconsin have recovered, and 362 deaths have occurred. When we look at the country as a whole, when we start viewing and looking at all of the states and the counties throughout the country, you can see where the hotspots are. Certainly up here in the Northeast, Boston down to Maryland, as well as the West Coast in the Seattle area, California, the Phoenix area, as well as here in the Midwest, particularly in Minnesota, Wisconsin, Illinois, and Michigan. So, when we start looking at not just at the general population as a whole, but let's try to figure out what's going on in Indian country. So this is a slide from reported sites from federal, tribal, and urban programs throughout the country. And this is updated as of May 4th. And as you go through from left to right, you can see IHS and the federal sites. And you can see where, Alaska, Albuquerque, Bemidji, in IHS terms, that is, Minnesota, Wisconsin, Michigan, and Illinois. And obviously the highlight of this distribution, you can see where Navajo, and we've heard a lot of news about Navajo and the tribe and the individuals. They have certainly been impacted by this tremendously, and I continue to follow this, and certainly looks like they will continue to have confirmed cases that will continue to go up. But when you also look at these areas, you'll see that there's at least two more areas that are greatly impacted, and that's Albuquerque and Phoenix. And so what we're seeing are, a Southwest area that's been really impacted. Now, when you look at the numbers, you may say, well, this doesn't look like a lot. And I would say, any number that's positive is a lot. But I think you also have to look at this with a grain of salt, because I think it's a bit of underreporting. Reason why I say that is when you look at the numbers, um, there are certainly mandates and obligations of reporting data. And so when we look at these numbers, federal sites really are obligated to report their confirmed cases. When we start talking about is tribal numbers involved in this, and I'd say it's certainly possible, but I can't say with 100% certainty that every tribe is reporting confirmed cases. Main reasons is there's no mandate and there's no obligation that tribes need to submit or have to submit. They are their own sovereign entities and have their own health systems, and so they're not obligated to report. Urban sites are not mandated or obligated as well. However, they are part of all three of the federal, tribal, and urban systems. They're part of a bigger system here. So it's important to realize that numbers that you see, even from our sister agency, the Indian Health Service, do take this with the idea that this is more than likely an underreporting of cases, and that's important to know, because as I go through some information here, you'll understand and see why the numbers that we see from IHS aren't the same that we see from public health data. So, so here in the Midwest, you see in the middle screen here, Wisconsin at 8,901. Michigan, in its earlier part of this crisis, was really the forerunner in terms of the number of cases. They've plateaued now, and they are at 44,397. Indiana has been steady at 21,000. Illinois continues to surge and continue to exponentially grow in the number of cases. And interestingly enough, Minnesota, which about 2 or 3 weeks ago was really had fewer cases than even Wisconsin, and these numbers are as of late last night. So they have gained probably close to about 6,000 cases in the last 7 days, and it was unsure as to why Minnesota was lagging behind in confirmed cases, but they have certainly caught up, and I suspect Minnesota will surpass Wisconsin here in short order, if not by tomorrow, certainly by Monday. So it certainly isn't a lack of testing. They are testing. Their cases are now are coming forward. So it's important to realize that every day changes, and this information is really flowing very quickly, as well as the transmission. So looking a little closer at each one of these states, when we look at the state of Michigan, we have a native population of about 60,000, and this is public health information, so it's not new. But we also, what I took a chance here is to look at all of the tribes and look at the tribes in relation to the county that they reside in. When you go on the Michigan State's Public Health Department website, what you'll see are some very generic numbers about race and ethnicity. And without being absolute, we know from the state of Michigan that 1% of the population, of the native population, have confirmed cases of COVID. Now, the hard thing about that is you don't know exact. There's no absolute numbers. They just report out a rate, so 1%, 2%, 3%. For natives in Michigan, it's 1%. So trying to backtrack into identifying tribes associated in the counties that they reside in, you could look at the counties, and you can start adding up the number of cases that are in that county. But again, even if you go to those county health departments, they don't delineate the number of native, how many of those cases are actually native. So the cases are actually inferred, but they're not absolute. And so you can see here in the county of Kalamazoo, down in the southwestern part of the state, there's 559 cases, at least in that county. That doesn't mean that all 559 are native. We don't know the ratio because Kalamazoo doesn't delineate how many cases are in. So again, the data is hard. It's difficult to find out unless each tribe separately designates or at least announces their caseload, which more than likely they won't. So so the cases here are inferred to counties and as to the tribes that reside in those areas. So so that's Michigan. Certainly in the state of Minnesota, we also have our tribal areas related to the counties that they reside in. So you can see in the northern part of the state, if I go back here, you can see in the counties in the northern part of the state, they're actually quite few. There are not a lot of cases, which is good. But again, each case in a county doesn't necessarily designate that is a native case. It's inferred, but not absolute. And so as you go through each tribe in the state, you can see where the county, and there's multiple overlaps of counties, it's pretty hard to determine absolute numbers, but it certainly gives you an idea of the region and the impact that could be affected to each tribe. So you can see, let's say Leech Lake has overlaps 4 counties. It has 4 cases when you add up all the cases in those counties, but I can't say that all 20 are native. So that's the difficult part of identifying cases in native country. But believe me, each county, each tribe is trying to manage the best and test who they can, where they can. So here in Wisconsin, you can see the counties and the overlapping reservations as it relates to the counties that they reside in. So we're all familiar with the 11 tribes of Wisconsin and the associated counties. So, and the number of cases. Now you can look at Oneida. They overlap Brown County and Outagamie. Now, we know that Brown County has had a lot of clusters. They've kind of surged in the number of cases. They're certainly dealing with a significant amount of cases, but 1,500 cases doesn't mean there are 1,500 Native individuals. I've heard through word of mouth how many cases there are. The last number I heard was 12. So, you know, even though there are large cases in counties, again, the numbers are so scant and not absolute that it's hard to determine how many Native cases are actually been identified. Now, Wisconsin's Public Health Department, their website, they give out daily updates, and for the Native population of Wisconsin, as of last night, there have been 90 identified cases. And that is consistent with 1% of the population now, the Native population. So the number of deaths as related is 4. Now, you have to remember that this is statewide, it's not countywide. So again, it's hard to delineate as to where all these cases are coming from. What we do know is that another issue that comes up is when you look at this left-hand column where you see multiple or other races. And there's another category of unknown. Now, what we know is, at least what the state identifies as 90 cases in Wisconsin. We don't know this category of other or unknown. There could be a greater number of natives that maybe check off multiple different races. But again, we don't know, and the state doesn't ask for more information regarding the demographics here. So again, another barrier to obtaining information. So in the state of Wisconsin, we're probably watching the news very carefully. We know that there are at least 7, if not 8 counties that are severely impacted by the COVID-19. Dane County, we know about Brown County, Waukesha, Rock County, Walworth County, Racine and Kenosha, and Milwaukee County. So when we look a little closer in terms of the numbers, Milwaukee County has almost 3,500 cases. Brown County has 1,600, and they have surged in the last week to 7 to 10 days. And that's mainly due to a lot of clusters that are occurring. Clusters that are occurring in meatpacking plants and individuals that have been tested, and even the individuals that are being tested, it is assumed that the household is COVID as well. So that not only do they report people who have been tested positive, but they assume that the whole household, so they count those as presumptive cases as being positive, even though they haven't been tested. Brown County, so Dane County, that's Madison area. Kenosha, Racine, these are counties that are adjacent to Illinois. And I put up Illinois here just to give some context to what's going on. So McHenry and Lake County, these are just the northern border of Illinois, just below Walworth and Kenosha. So these counties, McHenry and Lake, these are obviously feeder counties to Chicago. And so they have very large cases. Cook County has 18,000 cases. And Chicago, the city of Chicago, has 26,000 cases. So you can see Illinois, almost 66,000. They are testing a lot in comparison to Wisconsin. We're just under 9,000 cases. Certainly the impact is not seen as greatly as it is in the northern aspects of Illinois. So as of right now, there are 4 counties that have not reported a case. Otherwise, 68 of the 72 have. And most of the cases in the northern part of Wisconsin have reported, small numbers. So we may be talking 1, 2, 3, 5, maybe low double digits of maybe 10 to 15. But the number of cases are low, particularly above Wausau and northern aspect of Wisconsin. Coming down more into Milwaukee, this is where the Indian Health Service Center is. We're located on the south side. So when we start looking more closely at Milwaukee County, 3,500 cases, there's been over 200 deaths related. And down here in the left-hand corner, the number of new cases per day. It keeps fluctuating. There are days where we have low number of cases, mild, and then maybe some spiking cases per day. There's no rhyme or reason to it. It just comes in waves, and some days are low, some days are high. Now, when we look at what the capacity of Milwaukee is to address COVID cases, you can see that the ventilators that are used to help support individuals, they're currently in 24% in use. The ICU beds and floor beds, their capacity currently is fairly low. And before this even occurred, most hospitals run at close to 80 to 90% capacity. So when you see these numbers, you've got to put these in context to what happened even before this. So some of these hospitals their ICUs are running at half capacity, running their hospitals at 64% capacity, where normally they're much higher. So the number of cases that are actually hospitalized right now is certainly modest compared to what it was prior to COVID. If we take a closer look at the distribution of cases here in Milwaukee, if you can see on the left-hand side that the portion of self-identified natives in Milwaukee at 0.4%. 0.4%. So that's smaller than even the statewide recognition of cases. And so, but again, I take this with a grain of salt because I suspect there are more cases they're just not identifying as being such. So in this other category of other races or two or more races, this accounts for 3.2%. So I have to suspect that there are more cases in these categories. They're not just categories in the right manner. If you look on the right side of this picture, you can see the distribution of race and ethnicity. Far left being African Americans, the second column being white, and then Hispanic and Latino, Asian, and then all the way to the right, the second column on the right, 12 cases. That is 12 cases of self-identified American Indian and Alaska Natives. Well, you'd say, well, 12, that's really low. And I said, well, that's great that it's low as compared to other categories. But I do suspect there's more. They're just probably misclassified. So, but it's important to keep this in context as to where natives are in relation to the other groups here in Milwaukee. So what do we know about who's at risk about of getting COVID-19, the coronavirus? Well, we know anybody can get coronavirus. The transmission certainly does not discriminate of all classes, social and economic. However, the individuals that are definitely at high risk, the ones that we do know that are high risk of getting coronavirus, are individuals that are over the age of 65. We do know that nursing homes and long-term care facilities have a higher risk, mainly because of age and multiple medical problems that they have. We also know individuals that are high risk, so this includes individuals that have chronic lung disease, COPD, moderate to severe asthma that's uncontrolled, people with serious heart conditions, whether that be heart failure, heart transplant, heart attacks, heart valve, mitral valve replacements. Certainly these individuals are at high risk. Individuals that are immunocompromised from either being diagnosed with cancer, ongoing cancer treatment and chemotherapy, individuals who have BMIs over 40, and other medical conditions that are uncontrolled, specifically diabetes, kidney failure, and liver failure. Given our population with high incidence of diabetes, certainly if they're uncontrolled, it makes them at risk, at higher risk than the general population. Certainly individuals who have or who are on medication or treatment that place them in an immunocompromised position, bone marrow transplant people, organ transplant, autoimmune deficiencies, rheumatoid arthritis, poorly controlled HIV or AIDS, or individuals that are chronically on corticosteroid therapy. All of these individuals, and you may know a family member, your mom, dad, uncles, relatives, brother, sister, certainly may fit into this category. You don't have to be over the age of 65. If you have one of these underlying lung conditions, you're at risk. And so that's important to realize how important that'll be to help minimize transmission of coronavirus. I know people have certainly heard this, and certainly it's important, and it's important every day. The best thing that you could do to protect yourself is keep your hands clean, and cleaning that requires washing your hands. So washing your hands, soap and water, 20 seconds, and it's just not the quick, blah, 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 and you run your hands. You got to scrub between your fingers, try to get underneath the fingernails, along the nails, get 20 seconds, lather, wash them, and for a good 20 seconds. It's important to do this. So if you aren't by a faucet that has soap, the alternative would be using hand sanitizer. And it's important to know and note that on the sanitizer, it needs to say 60% or higher of ethyl alcohol. This, along with soap, the reason why these two particular items for cleaning are identified is that the soap can actually inactivate the virus. And so it's important that if you have it on your hands, that you do use soap and water. The soap itself inactivates the virus. Same with hand sanitizer. Now, what's better? Is it hand sanitizer or soap and water? The best is, it's not 100%, but it is really, really effective, is washing your hands with soap and water. That is the number one protector than hand sanitizer. And the most important thing, and I reiterate this to the staff here at GLIC, is avoid touching your eyes, nose, and mouth. So this would be assuming that your hands, wherever you go, touching a doorknob, touching a door, touching any surface, you have to assume that everything out in the general public, just assume it's contaminated. And assume that there's virus out there. So it's important that whatever you touch, that you always are in the constant habit of washing your hands. And most importantly, when they say don't touch your face, what they're really trying to say is don't touch your hand to your eyes. And so no rubbing of your eyes, no nose or mouth. And so that's the entryway, along with the droplet, of course, but the most direct way is your hands to your eyes, nose, and mouth. That is what you need to not do. So what do you do if someone is sick at home? And obviously we all are impacted by this. We all know someone who has been infected. When people get tested, they're asked to go home and quarantine themselves. Well, the same is true in a household. So when an individual does become positive with the virus, within the home, you need to consider isolating and quarantining that individual even within the house. So it's important that there's a designated area for this individual with a designated bathroom, separate if at all possible. Avoid sharing any household items such as dishware, towels, or even bedding. They need to have their own dedicated, household items. If you have a face mask, it would be advisable to wear one in the presence. I wouldn't recommend necessarily say you have to wear it 24/7, but I think if you're going to be in close contact within 6 feet for a prolonged period of time, you need to protect yourself and wear a face mask when there is that encounter. So as far as the face mask is concerned, the individual who is sick, I think it's going to be important that they wear a face mask when they're outside of their isolated area. So to minimize their virus exposure and transmission, they should wear a mask if they need to leave their designated area within the home. Washing your hands, soap and water, or the hand sanitizer, that doesn't change. In the house, you need to clean all your surfaces on a regular basis, if not a couple, 3 or 4 times a day. Your countertops, your laptops, your tabletops, your doorknobs, anywhere that you would think that an individual may grab and touch, you need to clean on a regular basis. And certainly washing clothes, you need to wash them on a regular basis. And again, using detergent, the soap, that washing your clothes will certainly inactivate the virus. So you don't need to separate clothes. They could all go in the same washer. The important thing is using the laundry soap, which will inactivate the virus when they're being washed. As far as cleaning and disinfectant, so as I mentioned, it's important to clean all your surfaces that you commonly use. That includes your cell phones, as well as bathrooms, toilet faucets, sinks. In terms of disinfectant, there are EPA registered household disinfectants out there that are effective against the coronavirus. I provided a solution mix recipe that you can use at home with the bleach in 5 tablespoons of bleach per gallon of water, or 4 teaspoons of bleach per quart of water. So it's important that you have the ratio. You don't want to be too toxic, but you don't want to minimize. So this is what's been known to be effective. In terms of household products that you can actually buy, so products like Clorox, Perel, Lysol disinfectant spray, these products have been known and have shown to be effective, not only disinfecting surfaces, but also have been shown to destroy and inactivate virus. However, I will say that each product is not the same. If you're going to use these products and disinfect your home, you need to use it on all surfaces, but you need to wait at least 10 minutes before you can actually handle those surfaces or touch those surfaces. It will take up to 10 minutes to destroy the coronavirus. So just by using it, you do need to wait 10 minutes before you can touch it again. And just so people here that are in attendance know, we are offering a Safer at Home kits. So this includes personal items, personal hygiene items, as well as cleaning products. So the cleaning products that we offer are detergent. We do offer bleach. We offer hand soap and bars of soap that upon request, you can come and pick it up, and we'll be glad to offer that for yourself and your home and your family to keep yourself as safe as possible. Another aspect of our clinic is we do offer family kits. Our Youth Empowerment Program is offering family kits to individuals upon request, so it's important. We have personal items that can be given out, and that games are also can be used as part of this kit that people can enjoy at home. Given the isolation and the Safer at Home enforcement has been ongoing for so long, we obviously have people that are at home, and the concern of certainly domestic violence, sexual assault. Our program, Circles of Strength, we certainly offer the ability to reach out and contact. So we know how this can be very stressful on families right now. So it's important to realize that there are outlets and services available, even where you least realize. So calling the clinic and connecting can certainly help in case you are involved or a victim of domestic violence or assault. We also offer testing. So right now we're testing individuals that exhibit any symptoms such as fever, cough, shortness of breath, sore throat, headache, extreme fatigue or nausea, vomiting, diarrhea, loss of smell or taste. Our phone number here is posted, 414-389-9526. It will prompt you. Press the medical button, press 1 for the medical clinic, and when prompted, press 4 to discuss your signs or symptoms of the coronavirus. We will certainly evaluate and assess and determine if testing is appropriate for you. And so we have testing at our clinic. It is a drive-through testing center. So we offer that to everyone. So if you have concerns that either yourself or a family member may have signs or symptoms, please don't hesitate to call. We'll be more than happy to address your concerns. And obviously, you know, these are washing your hands. And this kind of gives you a quick step-by-step process of what to do, how to do it, and for how long, and where, and rinsing your hands in 10 seconds. And so it's extremely important that that is going to be the mainstay of everyone's daily life is washing your hands. And so what else, Jeremiah and Mark, I'll certainly turn this back over to you guys and certainly address any questions or comments that may have come up.
I do have a question, and this one came to me last night when I was talking to some relatives about what's happening in Indian country. We do have a lot of people that are sewers, crafters, and so on. They make money that way with POWs not in session. They're making what they can because that's how they make their living. They also give things away. What I'm holding up here is just one of 4 boxes that our household received from relatives and friends, and that is a cloth face mask, right, made of material that was left over from dresses and ribbon shirts. So I'm going to couch this in a question maybe you can handle in 2 different ways. One is, a lot of our houses, we're living with 2 and 3 generations. So meaning our kids are going out. We don't know where they're going when they're coming back. I heard you say, hey, you know, assume everybody and everything's infected and behave as such. And that was great advice for those young folks coming back in. But there are also those young responsible kids who are native and identify as native. Now these are beginning to be branded with the missing and murdered women sort of iconography or symbols. And they're used a lot. You know, when I drive around, sometimes I'll see a native car, I know right away, because this is hanging off a rear view mirror on the car. So what's your advice to Indian country out there when it comes to us using these kinds of masks and making them for other people and sending them around?
So, you know, I've had these discussions often, not only with my staff, but also on all types of committees or councils. And so the best advice right now would be to protect yourself as much as you can, certainly in the public. So I know people can't get medical grade high-end face mask or surgical or N95s. The coverings that you just showed, and certainly what you know, native sewers and crafts people are generating, I'd say that is better than nothing. So it's important that being in the general public, wherever that may be, even as you mentioned, having multi-generational living situations, the best thing would be to find something that would help, whatever design, whatever promotion, or whatever group that you may be identifying or supporting. it really doesn't matter as long as there is a level of coverage that you are, a layer of covering that you are providing yourself. I think it's going to be important with that multi-generational living from, we know that younger people certainly can get it, but younger people, I'm talking about the 20 and younger age groups. The number of cases in that group, yes, there are cases, but it's much lower than, let's say, the 30 age group or the 40 age group or 50. These are the cases that are going up much higher. So if we're talking about youth or adolescents or young adults, certainly in the public, something is better than nothing. But when you talk about multi-generational living, where you have, mom, dad, with maybe grandma or grandpa, and their kids have kids, and so we're talking about 3 generations in the same household. We know that grandma and grandpa, or their aunties or their uncles, who may be over 65 with risk factors of diabetes or other medical problems, there needs to be a level of protection even within those homes itself. So even though young people may be wearing masks, when they get home, there still needs to be a level of protection even in these own homes. So it's important that protecting our elders is just as important being out in public as it is in the house itself. So you need to follow these general rules and principles that'll help protect not only yourself, but also your elders.
Just one last follow-up on that particular question. A family member in my home's just off screen saying, once we've used these, is it best to wash them, to leave them for 3-4 days in the sun? How do we deal with these cloth once used?
Sure. So if you're talking about cloth, what you just held up, I think you could throw that in the laundry just like your normal wash, and dry it just like you normally would any other clothing item. And they're reusable, and that's the point, that they are reusable, and you could wash them as you would normally wash your clothes.
Thank you. Jeremiah, I think we have a question that came across online. Maybe you can take that one from Stephanie, I believe. Jeremiah?
Yep. Stephanie McCabe was asking, in my part of the country, people are literally threatening civil war if the consortium of health departments don't ease restrictions. From solely a medical public health perspective, what specific things, example, rate of infection, determine how long restrictions remain in place?
So that's, I certainly have this discussion quite often, and it's a difficult one, and it's really the $1 million question. There's going to be no perfect solution on this. I know one of the metrics by which a lot of states are looking at, and Wisconsin is using that as a metric, one of its metrics right now, and that is the number of positive cases, the rate of positive cases to the overall number of tests being done. So if there is a trend in the rate of these cases, it is a good sign, a good indication that the general population as a whole, the number of cases are going down. So I hear in Wisconsin, the last 5 days, about 5 days ago, we had 11% of all tests being done were positive, and every day since then has gone down incrementally. We're at 8% right now. I suspect with the number of tests that we keep doing, the higher the number, we will not only be identifying individuals, but that rate will continue to go down. That would be a good barometer. It can't be the only metric, because there could be one day that you may have a cluster, and that will throw your numbers and your trends off. And so you really have to take each day, each week, each 2-week blocks as indications as to how society can open up. I know there are, certain states that are opening up society on a limited basis. And so, we all don't want to have or transmit the virus in the community. We all know that. We certainly have concerns about everyone's well-being, and rightly so. But at the same time, we do know that in Native communities and even in urban settings, that health disparities are real. And I mean that not just from a medical standpoint, but also from a social economic perspective. We have more natives that live in poverty. Um, um, Unemployment is much higher. We talked about multi-generational home living. We talk about social services and needs. And so we just know that natives as a whole, not just on reservations, but also in the urban setting, are impacted by all these tremendous risk factors in terms of workforce development and, and mental health issues and disorders are certainly not unique to just natives, but access to care is. And so it's important that when we take this idea of opening up, that we really need to take everything as much into consideration as possible, and that includes the native voice as well, because it's going to be important that the longer society is closed or people are laid off or furloughed, the harder it will be for these families to come back from. And what I mean by that is, if people were employed and now unemployed and not generating income for a family that one individual may be supporting not only their family, but also their grandparents, it's going to be pretty hard for that family to make it. And it's going to be even more difficult as time goes by. So I wish I had the answer for this, but I think the general sense that it may have to be sooner rather than later.
Dr. Ignace, I do have a question that's culturally related. And I know that at the Ignace Health Center, IHS Center, you have a culture team that's been working together trying to help people. And one of the questions that came through loud and clear last night was concern about any cultural practices that we have that may help spread the transmission of COVID-19 unknowingly, meaning there are some of our families that are very in tune with the language of COVID-19 and prevention. So especially with the vulnerability of older people and funerals, that kind of thing. One family was like, any well-wishers, we want you to videotape your message to the family and friends and mourners. Another family in that same day said, we're going to put out a fire and for that 4 days, which is customary in our Great Lakes area for our traditional families. And the invitation went out that anybody who wants to come, please come. So both families are doing the right thing by mourning their person that they've lost, certainly, and our heart goes out to them. But are there things within our culture that we need to be aware of that are creating vulnerabilities within our own people?
Sure. So you touched on a couple things, and one is the transmission of the coronavirus, either unwillingly or not even knowing that they are symptom, or even if they have mild symptoms, there may not be the necessary protections that are being demonstrated to help protect the people around them, certainly in gatherings and even in closed sessions such as sweat lodges, or even rooms where obviously it's customary for a social mingling and gathering in certainly times of funerals or people passing. So there are ceremonial things that in traditions that do occur. The best thing may be to limit how many people are in a particular area at any given time, and maybe these events may need to be more outdoors rather than indoors, in a level of protection, and that includes maybe a mask or even a cloth or some type of covering when we know there's going to be interaction and engagement. So, given the need to not only mourn but also to provide services, it is a very difficult time, and certainly families need to process and go through the traditional aspects of an individual passing. But I think I think everyone needs to have the mindset of trying to protect themselves as well as protect them from individuals being exposed, and that really what it really comes down to is limiting that exposure. So a covering mask, as you had shown, certainly would be helpful in that regard. Although it's not 100%, nothing is, but it certainly will help reduce and allow some limited gathering during these events.
For those of you just joining us, thank you. Jeremiah is one of the other folks who's moderating our questions here, and I do see 2 new questions on the screen. Jeremiah, if you could relate those, please, and we'll turn it over to you and Dr. Ignace for those 2 questions. And there's several questions embedded within. They're very good. So, Jeremiah?
Sure. So we have a question, again, this kind of relates back to the face mask issue and more of I guess, related to the community as well. Do we know how many Native households are in need of face masks in our community? And can people drop those off at Glick? And also, are there any other donations community members can make to help out the fight against COVID?
So you bring up a very good point in terms of face masks. So, everyone talks about these personal protective equipment, and that includes not only face masks, goggles, masks itself, gloves, and the coverings you see on TV. We would certainly love to be able to distribute masks out to the general public, certainly to our Native community. And we're certainly in a position to be able to offer what we can. It may not be a lot, but it may be a mask or a mask, a number of masks for a household. I think we could support that effort. You had mentioned whether or not the community as a whole can help support each other, and that would probably be the one biggest effort that the community could do. If there are beaters and sewers out there that are willing and able to make these coverings, if they're looking for a place to help distribute those, we'd be more than happy to support that effort. And so that would probably be the one biggest thing that could be offered to help support the Native community. I would also offer that we have these sorry. We do have these cleaning kits that do provide detergent and bleach and soap. So again, we do have these offerings. So do call us and set up a time for this particular kit. We can offer that to you as well. So I know times may be tough, and there may be certain folks that can't even provide or have enough income for these extra items. We want to protect as many as we possibly can. So please feel free to call, and we can help set up these cleaning kits for you.
Dr. Ignace, if I could just add too, if you want to go to our Facebook page, you can find more information on these Safer at Home kits as well.
You said there was one more question?
There is, Dr. Ignace, and this one is about kind of personal conduct when coming in the house. This one says, I've been peeling off clothes. I wear them to go out in public and then toss them in the dryer. I'll then run them through the sanitation cycle, high heat at 60 minutes. Do you feel that this is sufficient instead of sending them through the washer?
It hasn't been shown or demonstrated, or at least written about, whether or not the sanitation cycle itself will inactivate or destroy the virus. What we do know is that from a cellular, this goes back to being a little scientific, but when you look at the virus as a whole has an envelope to help protect it. What destroys the virus is being able to destroy that protective barrier. And what does that is the soap. Soap is a lipid. What that does is that it disrupts the protective barrier of the virus. And when you disrupt that virus, the virus implodes on itself and becomes inactivated and inability to infect anyone. So as far as routines, coming out from the general public, being in the market or being at the store, wherever you need to go, it is just assumed that your hands and your clothes have been exposed. When you come into the house, it's important that you have a routine of discarding, not like throw away, but put your clothes that you are wearing in the public into an area. Clean, wash, take a shower, new items, and the clothes that you were wearing, take those clothes, and if you can, either bunch them in an area for a day or two if you have to go to a laundromat. But again, that clothes that what you just wore that day being out should be washed, and I would suggest washing it with detergent, and not just use or rely on the sanitation cycle to destroy it, because you would take a tremendous amount of heat to be able to do that. So washing with detergent is the best approach.
Thank you for that. As we know, there's folks coming in and out, and if you're just joining us, you're with Dr. Lyle Ignace of the Ignace Health Center in Milwaukee. So if you have any questions, please weigh in. I do have another question that came in from last night, knowing that this session was coming in, and this is when families have someone in the hospital. The example is they just found out someone's going into the hospital, suspected COVID-19, emergency room visit. People want to be supportive, and either they go in then or they go in the morning after or afternoon a few hours later. What is the hospital expecting or looking for when people are walking through that hospital door? Are they being stopped? Are they being encouraged to even come? Are they expected to be wearing something or doing something before they enter medical facility?
So this has certainly been a hot point of contention, and we hear about it in the news all the time. Individuals that have been demonstrated not only to be ill from coronavirus, but so ill that they need to be in isolation. And that's basically what it comes down to, is individuals are isolated and limit their exposure to not only other hospital patients that may not have it, but also in isolation to also the hospital staff and nurses, doctors, anybody who works in the hospital. So that level of isolation is taking up to very high levels. And so the expectation is that they want to minimize risk of transmission to not only themselves, employees, staff, but also risk of exposure to people who may be visiting the hospital for a loved one. My sense right now is that they're limiting it to only one person, but even that one person may not necessarily be able to go in and actually visit and be face-to-face, especially if they're in the ICU setting. So that's the unfortunate part of all of this, is individuals that may be sick enough to be in the hospital with this exposure. The expectation is the hospital wants to limit exposure as much as possible across the board. So they may even limit or insist that people not come to the hospital unless they are positive, or not positive, unless they are sick and need health treatments. And so it's an unfortunate situation, but the expectation, if you do go, you will need to they'll probably provide a mask for you. Certainly a higher level of protection than the cloth covering that you see people wear. They maybe provide surgical masks, which are higher grade, medical grade, to help protect individuals from respiratory droplets or transmission.
Jeremiah, I'm going to take this question, and you can take the second one that just came in. As you know, Dr. Ignace, a lot of the information coming towards Native folks is coming through Facebook. It's coming through Google. It's coming through YouTube. It's the conversation that someone had with someone else listening to the police scanner, whatever that may be. And there's the struggle to understand and wade through what is true and what is not, what works and what doesn't. With that in mind, what just came in from Juanita is this input about some doctors on Facebook said that, I'm assuming, healing or keeping COVID at bay, what will kill it is hot drinks and hot liquids. And this is on Facebook, this is on YouTube, and this is on Google. So I don't want to misrepresent that question, but it is representative of where people are getting information. How can our Native community find out? This is what science seems to be telling us. And this is something that looks more like either an old kind of holdover from homespun practices that don't work, or something that they heard and take it and believe it because they trust and love the person that told them.
Sure. No, believe me, people will get their information where they get their information, and sometimes it's good advice and sometimes it's bad. And maybe that could be part of another series of myth busters discussion. So drinking either hot drinks or liquids, and you can certainly hear alcohol has been thrown out there as being a destroyer of the virus. All of that is false. It hasn't been shown, hasn't been demonstrated, hasn't been even effective in limiting your exposure. So I would not take that level of information. I would say that is a myth and a falsehood as to suggest that it would or can protect you from getting the COVID-19 virus. So don't believe that. It hasn't been shown, and I haven't seen one article that would even support that notion.
Jeremiah?
Yeah, so we've had a couple questions that kind of are centered around the same idea. So I'll just maybe combine them into a general question, which I think has to do with care outside of COVID-related care for GLIC. And so people have been asking, are you still treating or providing methods for people battling with drug addiction, or people who are sexually active, as well as the issues with, obviously right now with COVID, a lot of people are out of work and maybe don't have insurance at this time. Can people make appointments that maybe don't have insurance at this time?
So that's the beauty of the Indian Health Center here in Milwaukee, is that we will see anybody and anyone, whether you have insurance or not. We will certainly provide care and provide services. So just because we are in the safer at home, the health center is open and will continue to be open. Um, we've reduced our face-to-face encounters, but that doesn't mean we don't. We do see people. We see people here in the clinic every day for obvious reasons, whether it's related to one of their chronic care diseases or the management of it. We do blood tests. We still maintain a higher level of medical care that's comprehensive. So just because we are in the safer at home does not mean we do not provide services. We do provide services to expectant mothers, to pediatrics, to adolescents, to young adults, to even our elders. The only thing that we ask is that you call ahead, make an appointment, and once you come here for that physical face-to-face encounter, we will provide you with a mask. We will provide you with a mask to help protect you as well as to protect us. And we will provide a service. So we do provide emergency dental care. We still provide primary care services. We also provide mental health services. So again, that is both kids, adolescents, adults, whether it be mental health problems, addiction, or substance abuse, we still offer these services. So don't feel that because you hear, telehealth, we do provide telehealth services as well. So either if you have a smartphone, flip phone, whatever social media you have, we will reach out and connect. You just have to make an appointment.
This question comes in from R. Greger and says, would it be best to say follows the CDC guidelines, CDC meaning Center for Disease Control guidelines, for info on COVID? Is CDC a responsible place to get information? I do understand the question. It is one of those things on Facebook that there are so many conspiracy theories, so many folks saying the CDC is a part of a deep state plot and all that kind of stuff. I hate to bring it up in this kind of context, but it is legitimate, and it does cause people concerns as to whether the Center of Disease Control is a reliable and responsible place to get information for health.
So just so everyone knows, the CDC, as well as the Health and Human Service, National Institutes of Health, these are the individuals that are on the forefront and have developed not only the guidelines, but also the recommendations. So this isn't whatever the CDC comes out with in terms of information. This isn't their first jog around the block. We've dealt with corona-like viruses in the past, in particular like the Ebola virus, the H1N1, the swine flu, SARS and MERS infections as well. So the CDC is at the forefront of addressing pandemics or epidemics. They are the ones that offer the information on influenza, the seasonal influenza, or any other outbreak of a disease. They are the ones at the forefront. They are the ones that have developed and helped create the public health approach on this. Now, whether you want to support that public health approach or not, it is still good advice. And the cornerstones of at least this, if there's a take-home message that the CDC offers, is washing your hands and don't touch your eyes, nose, or mouth. These are probably the two main things. If you ever get a take from either the CDC or even this discussion, in order to protect yourself, wash your hands and don't touch your eyes, nose, or mouth wherever you go. That's true for not just for COVID, that's true for the common cold, that's true for pneumonias, that's true for influenza or any other type of virus. You want to minimize your exposure, and that means entry of that virus into your body. And the only way it gets in is through your eyes, nose, or mouth.
One of the questions I heard last night from relatives was there's not been much talk around folks with diabetes dealing with obesity. are those at-risk populations in our community?
Absolutely. They are probably the top category of people at risk. Now, how that risk is associated with either a higher level of illness or even unfortunate outcomes of death, we just know that individuals with chronic diseases do have a much harder time mounting a response, not only an immune response, but also the physiologic changes that occur in the body when you do get sick. Obesity, and this is BMIs over 40. So we know that individuals have a much harder time clearing their lungs, breathing normally. And so this obesity, and we're talking morbid obesity of a BMI of over 40, they have a much harder time with maintaining not only their respirations but also clearing secretions from their lung when they when they carry a lot more weight. So I don't have that slide. I thought about adding that to this, but certainly listing out 90% of all COVID-related cases that are in the hospital has to do with at least one of these risk factors: high blood pressure, COPD, diabetes, underlying lung problems as being, and cardiac problems as being the top 5 health-related. 90% of cases in the hospital are associated with one, if not more than one, of these health problems.
Can you break down just a bit what you meant in kind of layman's terms, what you mean by what is a chronic disease and what are BMIs?
Sorry to get too technical, but so chronic diseases. So this would be the management of someone who has high blood pressure, management of COPD or emphysema, the management of chronic disease such as asthma, high blood pressure, heart failure, certainly people who have rheumatoid arthritis, joint problems, autoimmune problems. These are the chronic care terms. BMI is the body mass index. So this would represent, based on your height and weight, it is considered to be anything less than 25 is considered a normal weight for your height, whether you're male or female. When you start going above 25, 26 to 30, 35, that certainly is an indication the more weight individuals carry, the higher their weight to their height is, so that you can calculate your body mass index. When we get to 40, over 40, that would be considered morbid obesity. So this would be someone who is carrying maybe 100 pounds or more than what their height should be for that age. So that's what I mean by a BMI over 40. Body mass index over 40 means morbid obesity and over 100 pounds more than what their body should be carrying.
So a question to that one, where can one find a responsible site on BMI and know more about where they fit on that chart?
So you can Google it. You can Google it, and there's BMI calculators everywhere on the internet. So all you have to do is know your height and have a general sense of where your weight is. Put those two numbers in there. They'll give you a BMI. They'll calculate your BMI, and then whatever range you fall into, they will tell you, hey, you're normal. Hey, you're have obesity or moderate obesity or morbid obesity, and they'll tell you that the website should tell you at what level what you have to do or should do or consider doing to lower your number to a safer level.
Jeremiah, we got a couple more questions that came in. I'm going to hand those over to you after this one. In particular, I, as a Native person, live in a very social neighborhood. And what I'm seeing outside, and occasionally I have nieces, nephews come and visit, certainly, and they like to go outside. I'm seeing parents congregating around, what do they call it, wagons. They used to be made out of tin, now they're made out of cloth. Inside of those wagons, there's unfortunately around this neighborhood, a case of beer. Parents are there around that beer and having a nice cold adult beverage, I think they call it. And kids are playing and they're not really knowing who they are. It's just people are being social.
Mm-hmm.
What do I do with that niece or nephew that's coming in outside after kind of being around their new friends or visiting us for the first time? And of course, they gravitate towards those kids. What do I do when that child's coming back into my home?
Sure. So people are getting cabin fever without a doubt. They want to be out. They want to be social. I mean, as a society and just human nature of wanting to engage and be social. And so I'm not surprised that, events like this occur. However, what we know, data has shown young kids are certainly at a lower risk of getting COVID-19. But it doesn't mean that kids could be carriers. They could be carriers of the virus. They may not get sick like the older elders do, but that's the rub. That's where that level of protection or minimizing that exposure needs to occur. Kids will do what kids do. They want to play. They want to interact with their neighbors, their cousins, and so forth. I think it's going to be important when those kids come back in the home. They do the same thing everyone else do. They need to wash their hands. They need to wash their hands, their clothes. If they're out wrestling, hanging out, playing on the gym sets or whatever, again, wash your hands. You have to assume the clothes that they're wearing, you have to get them and shower just like us adults would need to do. You need to protect that multi-generational living arrangement that may be in these households. So you need to protect grandma and grandpa, your aunties and uncles who may be over 65, or if they're not over 65, maybe they have underlying health issues. Those are the people that are high risk to those kids that are interacting out in the neighborhood. So those kids that come in, they need to wash their hands. They may need to take a bath, take a shower, and get those clothes cleaned as soon as possible when they come back in the home. Again, in that home setting, you're still looking at disinfecting and cleaning everything. So if there was ever a sense or time when people need to be hyper vigilant about cleaning, this is the time. Doorknobs, counter surfaces, everything.
Jeremiah, I'm going to turn it over to you with our 2 questions coming in, and I think we're coming to the end of our time, but let's try and take care of these questions. Jeremiah?
Yeah, I was just going to say the same thing, Mark. Probably going to wrap it up here pretty soon. But so as we know, there was sometimes conflict between Western medicine and traditional medicine. How do you suggest we address this while maintaining and respecting traditional beliefs, but still conveying the severity and seriousness of this illness? And are there any traditional medicines or treatments that have been shown to be beneficial in combating COVID-19?
Yeah, this is just one of those times where Western medicine has to meet with traditional. There has not been demonstrated or shown or written or discussed of any traditional home remedies that would be protecting of individuals. We know from a scientific basis that this is a virus, and viruses have been along in this world for a very long time. The unfortunate thing is, at this time, there hasn't been shown from a traditional aspect, that there is something out there that would help prevent natives from contracting the virus. That's the unfortunate thing. And this is where traditional approach would need to meet the Western approach on not only the certainly the diagnosis, but also the treatment. And hopefully we have a vaccine to prevent the transmission and contracting the coronavirus. This is going to be a difficult. This is going to be difficult, and certainly for parts of the country and individuals who rely on traditional medicine approach and rely on that for maintaining the health and well-being of themselves. Western medicine, this is probably one of those times where Western medicine and traditional medicine may have to work and coincide together on helping support Native communities across the country.
Dr. Ignace, I'm going to add something to Jeremiah's representing that question as a Medewan person. I know, for example, things have come across my view. One Sundance Lodge, and for those of you that may be new to our traditional religions, there's different kinds of religions, just as many as the tribes. And so one of those traditions is Sundance, and it was related that from this particular branch of Sundance practitioners, that if a home would put yellow tobacco ties, those smaller tobacco ties above the doorway of the home, that all the people in that home would be protected. And it came to be that some people understood and said, yes, that's my faith and that's what I'm going to do. While others said, well, that's all I have to do is tie those ties up, and they just conduct themselves as they would on any normal day, ignoring everything else because their elder told them hang yellow tobacco ties. Within our Three Fires Lodge, this is one of those things where I'm hoping medicine and our traditional thoughts come together at some particular point with research, meaning the instructions from our leadership in our Medewan Lodge was towards a certain tea, certain mixing, there's a time of picking and how we do that, and then just the certain amounts is prescribed. But in no way our leadership was very clear in saying you have to continue to practice the medicine that supports our medicine, meaning washing your hands, behaving as if when you were coming home that you had the virus, to protect our elder people, and certainly respect the practices and traditions of other faiths as well as medicine, modern medicine as well. So I just wanted to add that much on that one, because a lot of people put a lot of faith and belief in our elders and our traditions as they should. Mm-hmm. This kind of thing has been predicted. We've been told to plant our gardens. We've been told to do and be prepared for just what's happening now. And that lends itself to people believing that, well, since we heard it from those leaders, mm-hmm. those same leaders should have the exact remedy that will protect us. And I want to just emphasize that that leadership that has provided those prophecies is saying, work with our modern medicine practitioners and continue and to remember that all healing begins with prayer. And that's just my representation of my view. Thank you.
Sure, and that's certainly understandable and certainly a belief that I have. Because I think what as you described, could be the best approach to, the Medewan way traditional approaches, as well as modern day medicine. I think there could be a bridging, so to speak, where they both meet and could very well help even to a greater level.
Jeremiah, could you go to our last question and maybe give us a send-off onto when we'll meet next? Our last questions, I'm looking at it now. Sorry, Jeremiah.
Yeah, no problem. So we had one more question, and it's to the effect of, I think you've mentioned this, Dr. Ignace, in our, in clinic huddles or whatnot, but why and how can COVID-19 manifest as a gastrointestinal illness?
Mhm. So it's an interesting question. And so how we know that this virus is transmitted? It can be transmitted by a direct respiratory droplet, or just, when you cough, phlegm comes out. When you sneeze, phlegm comes out. That could be a direct entry into our respiratory system. But when we talk about transmission, we're also talking about the transmission of contact of surfaces or your hand to your eyes, nose, and mouth. And so if an exposed hand, let's say handles, or you touch your mouth, or even if you touch your contaminated hand of virus with food and you eat it, you are swallowing that virus. So it is conceivable that the virus is going through your GI tract. And so this is a new virus. Our bodies always are exposed to viruses. They're always exposed to bacteria, and it's how our body identifies with that virus and if it doesn't agree with it or feels that it is a foreign entity or something that is harmful to their bodies, the immediate reaction is to get rid of it. And so that's why symptoms such as either nausea, vomiting, or having diarrhea is to get rid of that virus. That is your body's own defense mechanism of how to get rid of this. And so it is that direct entry into our GI system through eating that our body is reacting to get rid of it. And so you may have symptoms of vomiting or diarrhea.
So the last piece that I would like to say for myself to everyone that's listening as we close this out is I recognize the input from Kitty, who suggested to the team at Ignace that this be archived and be made available to the public over time, because we're going to do a series of these. But lastly, for those of you that have tuned in, you've learned of this in a very short time. Mm-hmm. Meaning that you're very social connected and very socially aware. And those on this line are thought leaders in our community. Please tell people that we are holding these sessions, that we have Native specific questions that are different from a dominant culture. And this is a place that we can go as Native people talking to each other with those questions. I understand not a lot of our community has access at a certain time, certain place, or even access to internet. And if we as thought leaders can ask questions of those people that don't have the privilege of having the electronics to join something like this, that certainly please ask or try to recruit questions from them so you can get to them with good answers. Mm-hmm. So with that, I'm going to close my portion of this out and say thank you to each and every one of the viewers. Thank you to the Ignace Clinic, Dr. Ignace, Jeremiah. It was really great working with you guys. I am looking forward to more of these. There are so many more other questions that we need to deal with, and we need to hear them. So in parting, as I like to say, think Indigenous, do Indigenous. Thank you.
Thank you, Mark. And just to answer again a couple of those final questions on, yes, these are being recorded and we will post them on our YouTube channel, which is relatively new, which then of course will be shared out on all of our social media channels as well as our website. So if you maybe weren't able to make this one, or you know some people that would benefit from being able to watch this session, please look for the recording in those areas. And like Mark had said, this will be an ongoing weekly event. We will continue to do it Thursdays, 3 p.m. unless there are changes for schedule reasons. But other than that, Dr. Ignace, if you'd like to have a final send-off.
Thanks, Mark. Thanks, Jeremiah. So this is very, very difficult times, and difficult for all Native communities, whether you reside on reservations, whether you reside in the urban setting or in the suburbs. This is impacting all of us. And so my hope for these sessions and these upcoming weekly events is really to provide an outlet and maybe some insight and some observational experience in helping to assure that not only we help to protect you, but also your family and your extended relatives and your home and to the entire Native community in Milwaukee. So in order to do that, it's important to have an outlet such as this to be able to provide that type of information that is not only useful but also practical on a daily basis. And so, my message to the Native community: wash your hands as often and as many times as you feel that you need, and protect yourself as much as you can, and stay Native strong.